I'm gonna ask you a few questions. You can bounce them back, but that'll be easier. All right. Hand hygiene. So, hello, my name is Drake. I'm a nursing student from St. Francis. I'm gonna go ahead and do your postpartum assessment. Is that okay?
Yes.
Okay, cool. So the first thing I'm gonna do is I'm gonna take her vitals. I'm gonna do her pulse, blood pressure, wrap the cup around, and then take her temperature, and then record her respirations as well. And then I'm going to listen to her heart sounds first. Okay. The heart sounds there. Okay. And I'm going to listen to her breath sounds as well. And they sound clear and moist. And listen to her bowel sounds next in all 4 quadrants. And they sound active. Then next I would assess the breasts. I would ask her if she had any soft spots, hard spots, any warm areas, tenderness, any pain. Have you had any pain recently? No? How about like in your breast specifically? Have you had any pain? No? Okay. All right. And then going down, the teaching point I would make with the bowels would be it's normal. I would say it's normal for a mother right after having birth to not have a BM for about 2 to 3 days. So if you don't, that's okay. So have you had a BM recently or no? No. Okay. All right, that's fine. Now we'll come down and I would assess the uterus. First, I would palpate the bottom of the uterus or the uterus for support. And then I would locate the top of the uterus for the fundus. And then I would note the location and chart the location. So whether or not it was soft or boggy, whether or not it was midline or left or right, or whether it was all the way up to the umbilicus, 2 fingers above or 2 fingers below. After that, I would do some teaching about your bladder. So have you urinated recently? Have you avoided it all? Yeah, okay. And then I would ask some questions about how did it look? Did it smell funny?
No.
No? If it did smell funny, that could, or it's had a bad odor to it, that could indicate some sort of infection. Also maybe some bleeding. Might want to be, if there's excessive bleeding, that might want to be noted as well. Then I'll come down to the lochia, so she would have a pad. And I would ask her, when's the last time you had your pad changed?
An hour ago.
An hour ago, okay. So if I look, it'd be rubra or some other colors. I don't know exactly what the colors, but rubra was one of them. So she said hers was rubra, or I would say that. And then I would note how much there was, so she had a moderate amount. And I would say a teaching point would be if you change your pad within an hour, because we do it on an hourly basis, if it's saturated within an hour, like let your doctor or nurse know, because that could indicate some hemorrhaging. And then also if there was any blood clots, any bigger than like a golf ball size, to let us know. Okay. All right. Now we'll come down here to the assess for DVT, or no, sorry. I would assess for episiotomy. So any lacerations in the back or stitches. So go ahead and turn that way for me, okay? All right, and then I would use Rita. So redness, edema, ecchymosis, drainage, approximation. All right, so and then I would also note that and chart if I seen any redness, edema, ecchymosis, drainage, or approximation. I would also assess for epidural site for that as well. So go ahead and turn back for me now. So now I'm going to assess for DVT in your calves. I would check for any swelling, warmth, or possible pain. So I would ask, do you have any pain? I would compare that to her other leg to see if it does look any different. So no, it really doesn't. And then my last point would be, I would tell her that, hey, to prevent blood clots, you want to get up and move around. Okay, get up and don't lay in bed all day. Okay. And then lastly, if she had a C-section, I would want to assess the IV site for any to make sure that it is still an active IV site. If not, if it needs flushed or if it's still pumping meds or saline. Then I would look at the surgical site of the actual C-section and note the drainage. Mark it with a pen, or if it's moist and intact, the dressing is. And then as well as the if she had a Foley or catheter in, make sure that pericare is being dealt with the catheter as well, and to chart however much was being however much was coming out of the catheter. And yeah, anything else? I think that's it. Thank you.